How's everybody?
Good.
Good.
And we're recording, so whenever you want to start.
I'd like to go ahead and call this meeting to order. Has Dr. Kingsley joined us yet?
He is not.
Okay, and our quorum is 3.
Yes.
Seeing we have a quorum, I would like to go ahead and open the meeting. If we could put the agenda up there, I think at this point we will call the meeting to order. And usually the first item on it is, no, there you go. Let's do the roll call. Susan, I mean, absent. Kim, Michael Chaffee, present.
Zach Ronke, present.
And we have Dr. Kingsley.
I made it.
Would you like to stand and join us in the pledge?
Oh, yeah.
No, I pledge allegiance
Pledge
to the
allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right.
Do we have any guests or public attendees? I see none, so we will skip through that and hit past minutes, February 20 board meeting minutes. Presume everyone's had a chance to review those. I did at 7:30 this morning.
Yep,
Okay. I would entertain a motion to approve the minutes.
I move we accept the minutes from February 20th, 2025.
Seconded.
Moved and seconded. Any further discussion? Hearing none. Let's go to a roll call vote. Dr. Kingsley?
I wasn't there.
Okay. So, Zach,
Zach's a yes.
Michael Chaffee's a yes.
Jim's a yes.
Kim's a yes. It passes. All right, next item on the agenda.
So we really don't have any old business. In my report, we have a little bit of old business and it's the HVAC, and hopefully eventually this is going to be not business. But my
Okay,
understanding from the electrical contractor is that they will have, or actually the HVAC people, they're expecting the ship date for the equipment to be April 10th, and they are going to work hard to get it done and on the schedule within 2 weeks of that date. So I keep emphasizing we want that done before we start getting all the really humid weather, which is coming probably in April. But they know, and we've been on them all the time about it. Do you have a question?
they were contracted to and authorized to proceed with this fix. How long ago?
A while ago, and I will say it's not Hale's fault. They had some issues with the original heat strips not being available. They sent it back to the engineer. The engineer had
All right.
some delays, but
Would it be fair to say we should have this resolved by May 1st?
I hope so.
I hope so too. Okay, good enough.
I hope so.
All right.
Good news on the electrical front though, our big expensive breaker, we've had no other issues, knock on wood. As far as the budget, we are looking at the end of February, which is 16.7% of the year. We have, of course, collected much more revenue than that because we collect revenue at the beginning and end of the year. But for expenditures, we are at 15.4%. So we're right on target where we're supposed to be. As far as our money market balance at the end of February, we were a little over $250,000 ahead of where we were a year ago. So that's good. I mean, nothing, you have to still be very careful, but it's better than the other way. And then on our lease purchase agreement, we are about $250,000 down. We paid $243,000 more into the principal than we were at exactly a year ago. So
How much more again?
we have a total left of 2,217,745.
But what'd you say compared to a year ago? That's what I was.
We have paid down $243,683 worth of principal.
It sounded as though we are paying extra to drive that down as is budgeted.
Yes, that's absolutely correct.
Good enough.
So we're actually at the point now, we're just paying the regular payment because what we realized was so our regular payment 17 something and we were paying 22. Well, it actually makes more sense to take all those remainders of that 22 minus 17, whatever, pay that all at the beginning of the year. So you aren't paying interest on that. So
If I may, I believe our interest rate is 2.8%,
2.88. Yes.
2.88, and our money market just dropped to 3.79.
Yes. Good numbers.
So I believe the citizens of Platte County, just if I may, take the liberty, would rather make that 1%-ish on their money and have it go into the coffers of the health department. So I think it's a wise way to proceed. As long as the money market is exceeding the interest rate on the payments, my suggestion is to let the citizens' money grow to provide better services down the road.
And hopefully next month we'll be able to provide some guidance on what we are going to do to even extend that interest rate a little bit with the MOSIP. Because basically, like I mentioned earlier, we collect money at the beginning of the end of the year.
Yeah.
So the money we collect in January may not actually be being used to provide services till December. There's multiple products that we can use as far as CDs and different things to get even a better rate. But we're still working through all that.
Good.
That's all I have for you.
A lot of my work personally has been spent working with policies and procedures, kind of working with Taylor and the rest of the team as we go through the accreditation process. And as I kind of wind up my career, working with some of the staff that are relatively new to their positions as I divest my responsibilities. So don't have a lot to report other than that.
Can you tell me or tell us when your last day is planned for?
My official last day is July 5th, but my last work day is June 30th.
When is your get together?
June 26th, I believe, will be a get together here at the health department, which you will all, of course, be invited to.
What time?
I don't know. I'm not sure about that yet.
I won't block the whole day.
You'll be there to pick them up for breakfast?
Oh, we'll see, as long as I'm not out of town.
But no, we have a really solid staff. I think it's going to be nice to leave my responsibilities in the hands of some very, very dedicated and capable people. Does anyone have any questions about my report?
So just make sure you send us all that information when you finalize the plans and such.
Will do. Thank you. As you can see, the health education report and the environmental health report, as well as the family support worker activities, are included in my report. If anyone has any questions.
Okay. All right.
Hey, Andrew, can I make a request? Can you switch over to the screen on the computer? Because I see you guys, but I don't see what's on the screen.
Yeah. This one?
Yes. No, the other one. How's that?
That'll work. Thank you.
All right, for the clinic, we were actually today we ended up finishing the last of our back to school clinics in the schools. As you all are probably familiar, there's a lot of fun little weather incidents in February, so we had to do a lot of rescheduling. We finished getting the rest of the schools at Park Hill School District as well as Platte County R3, their back to school immunizations. WIC has been working really hard trying to get ready for their getting their EWIC cards up and going. They are training on that system this week, so they're pretty excited that they'll be able to start giving those out whenever they have WIC clients come in, which will enable them to just automatically refill the cards digitally as opposed to having people coming into the clinic to get their cards reloaded, which those who have a lot of transportation issues, this is going to be huge for them and help them out quite a bit. I did also share an attachment in my report that a couple of fun little stories from WIC. Brief summaries of them. One mother was just overall thankful for everything that WIC provides, all the services they do, and helping ensure that them and their family are taken care of. The other story is a little bit longer, but there was a patient who came in. The kid just had lost a bit of weight and wasn't looking as prior to like their previous visit. So the nutritionist kind of did some investigation and suspected diabetes for the kid, and turns out that was the case. They referred him to the doctor. He got checked out, diagnosed with that. And one of the sweeter things about it is his older sister actually has diabetes as well. So she's kind of taken on the role of like mentoring him and showing him how to do like checking his sugars, making sure everything's fine and all that. So it was a fun little story. We need some little happy things in for kind of time. So I want to include that. And then the rest of it, we've been working with Health Ed, trying to do some more outreach programs. We've gone to the YMCA doing some blood pressure checks for seniors primarily, but overall anyone who is interested in attending. And we're trying to help grow some of that and do some more partnerships with health educations at different events throughout the year. So, anyone have any questions for any of my reports? Oh, I will say, I kind of talked to Kim about this prior to the meeting. Swope's numbers were a little bit lower this past month. A lot of it was they do close. There were a lot of late starts for them during some of this more severe weather. And we had a meeting with them earlier this week as we're working on collaborating between Beacon as well as Swope and then with us for a referral process. And Gina, the clinic manager for Swope, informed us that like, a lot of the patients, when we had that little lull between their clinic opening here and our clinic closing here, that a lot of patients were being referred to the Riverside location and they never have left. So that could account to why some of the numbers haven't been as high as we expected them to be.
Fun fact.
Have we heard of any feedback from like patient satisfaction with Swope?
See, no comments yet from it, but I have did have a little bit of just basically the toilet holes and everything was just no complaints really in anything.
Fun fact, their location in Riverside used to be owned by Kendallwood Investment and Kendallwood Home Health. And I used to be their medical director in that building. Anyway. Small.
You know, Dustin told me something interesting about that. So we are, you know, we're not back up to our numbers, but during that transition, and I think you all remember, it was probably almost 6 weeks, 6 to 8 weeks that we weren't actually seeing people here and people were going to Riverside. Quite a few of the people just stuck with going there. They may have been coming, so they're getting the services, but that's actually closer for them. So that is actually, while it may not sound like a win, it is a win because it's actually closer for them and more convenient.
So I'd like to make a suggestion that the meeting minutes reflect that your report and the board acknowledges that in the transition to federally qualified health clinic here, those patients are seeking care 6 miles away, and I think they're continuing to go to that location, and that the citizens of Platte County are being served.
Yes.
Good enough.
That's what Dustin told me.
Yeah.
All right, accreditation updates. So we have about 13% complete. Like I said, it's kind of a difficult number to monitor because some of the things are very small, just smaller things. Some things are giant plans that take several months. We're working on lots of things like Dan mentioned. We've been doing a lot with policies and stuff lately. We are planning on having our strategic planning retreat next month, and we will have someone from MOCP, the Missouri Public Health Excellence, or I'm missing a word, Missouri Center for Public Health Excellence come next meeting, and she's gonna do a presentation here on strategic planning, and we'll have a little bit of like a conversation at that time about our strategic planning process. We've been doing a lot of stuff with quality improvement, and then working on the community health improvement plan. We hosted the SHIP community health improvement plan workshop here for several community members and partners. And we had determined the 3 priority areas, which mental and behavioral health and access to healthy foods are going to be continuing. And then the 3rd one is going to be changing from access to transportation to improving access to healthcare generally. And then it's going to have some sub themes of transportation and also targeting prevention of chronic diseases as well within that.
Question?
Yeah.
So April 15th, strategic planning, is that something the board members are encouraged to participate in?
So that on April 17th at the full board meeting, we're going to have the component that's going to be with board members.
Oh, okay, thank you.
Yes. So it should just be.
We did ask her, and she basically said how they have been doing it and how it's been working well for them, right, Taylor? Is basically what they said is do the employee part and then do the board part at the board meetings, basically.
Okay, so fall, at the conclusion of the board meeting on the 17th, we will participate in the strategic planning.
It will be part of the program.
Thank you.
Then I'd say a couple things about both Dustin's and Taylor's reports. Dustin will probably talk about it more next month, but we had the WIC site visit from Department of Health and Senior Services this week. So they come in and they observe everything that we're doing and look at everything. It was a little bit different this year. We had someone that was fairly new. And so there was actually quite a bit more findings than we have had in the past. But it was kind of like more like, I want to say nitpicky, and that's all the only way I can put it. It wasn't any real issues with the processes and stuff. That overall was very good from what I understand. It was, you didn't put a check mark here when it's supposed to be an X or whatever. So it was kind of formality stuff.
Yeah.
Is that accurate?
Like there was like a couple, like there was a T that wasn't capitalized when they wanted it to be a period at one spot that they had to have at the end of a document.
And they
then,
codify these recommendations in their report.
yeah.
They did. And
Um,
then we corrected them.
Yeah.
And what our message was to you, probably are going to hear about it next month, and that's why I wanted to preface it.
mhm.
This month is, it was kind of ridiculous. And it's kind of the sign of a brand new person who's trying to make sure they get every, there's realistic things and then there's things that matter and things that don't. All the things that matter, we do great at. And our WIC coordinator, Heidi, was fairly, not boo-hoo crying, just she likes to be great and she is great. So that's why I thought I'd mention it, is that they are doing a great job. You'll get kind of the overall briefing of the report, and it may look daunting, but it's not really a big deal.
Yeah, just kind of picking on that. Both of them, like, because they do like an administrative and then they do like a nutrition assessment for it. So both said that they were very impressed with the staff and like how friendly they were, and even commented that there are a lot of patients we've had that come here and then they'll end up like moving somewhere that there's a closer WIC clinic for them to attend to. But they choose to come here because they love our staff so much and like how friendly and helpful they are. So that's always a good thing to hear. To me, that matters a lot more than a missing period or a capital T.
These reviews are opportunities for improvement.
Right.
They are not grades and make us feel good issues. So it sounds as though a hypercritical reviewer found no substantive issues and a lot of clerical issues, which were opportunities for this health department to improve. There's nothing wrong with that.
Yeah, that's accurate.
Good.
And then just kind of mention what Taylor's been going through. You know, we have a deadline. And so there's lots of moving parts, and she has been quite a trooper, especially dealing with me. Because I see some things the second time around and I'm like, oh, I really don't like that. And she was counting on that being checked. But it is certainly, this whole process is going to be an excellent opportunity for us to look at all of our processes and really do some of that quality improvement stuff that you're talking about. I know we're really lucky that Dan is able to go through and write so many of these because he has a lot of the background. You know, I haven't been here 33 years, so Dan actually knows where that body is buried and why we do certain things. So that has been very, very helpful, and he's pretty prolific according to Taylor as far as just cranking out these documents and policies. I now have to sit more in the middle to the left of my chair because he specified that. I can't be too close.
Well, I apologize for the next comment, but I have to make it. Dan, for your, it's been my experience that people who have a wealth of knowledge and experience hopefully will find opportunities to form their own consulting LLC or firm and to perhaps be able to assist us in ways that perhaps no other individual could.
Perhaps, yeah.
It's a thought. I throw that out as a thought.
Yeah, yeah. Andrew has mentioned the possibility. I'm looking forward to some rest, but I imagine I will get bored after some short period of time. So I'm keeping an open mind about that. Thank you.
Take that as a compliment. All right, do we want to, anything else?
No, and
Okay.
Susan's not here, and we actually didn't have our finance committee meeting.
All right.
Cindy, do you have anything?
Bylaws annual review. I guess we're gonna need to schedule a meeting.
I'm a little confused about that, because I
Okay,
thought we
or
were
we can
scheduling
review it now.
Or we're just, we're now gonna review them in this.
We can, so I sent them out for everyone to look
Yeah,
at them
I
and
looked at
review. And if no one has any changes, we don't need to have them.
Given that I
What
think we
discussed
implemented
last
them
year.
about 6 months ago, is that?
No, it's been, you implemented them nearly 2 years ago. And then we reviewed them once
And we had changes.
and we had changes. So it's been a year since the change. Time does fly.
Does. boy.
So it calls for an annual review that we look at them, but it doesn't mean we have to meet or.
Okay, Zach, did you have a chance to review
Just briefly.
Fresh out,
Yeah,
okay.
yeah, I wasn't aware that this was going to be on.
them?
the
My
website.
memory's horrible and I read it like it was the first time, so I felt very comfortable with it. The Alzheimer's is kind of,
You know, you wrote some of that, right?
The only thing I see is,
it's the Alzheimer's.
yeah.
Or, no, wait. It's not official Alzheimer's, it's old timers. All right, thank you.
I can relate.
I do, but I want to make sure everybody was,
The only thing I see is then if we're going to do it in this manner, as just doing it as a board one time and not meeting, is this right here where it says that recommendations are made to the entire board for annual bylaw review at March meeting. I mean, do we need to say that the committee meets and makes recommendations, or does that need to stay in there, or should it be removed?
If I remember right, when we had our meeting talking about this, the issue was that if you don't pay attention to it, you can go years before somebody does anything. So
I understand.
I'm not saying we need to jump all over it every year. That's insane. But I do think that we do need to meet every once in a while to talk about, is there any updates, some changes, something that maybe is obsolete, that kind of stuff. I think that has to be put in there. So I think basically when we put that in there was to force us to at least acknowledge that, oh yeah, there are the bylaws. Let's make sure.
I would propose that we just say we will review them prior to, you annually with the board. I mean, just saying
Okay.
in that manner and not needing to meet separately. I think they're established. There's not gonna be a lot of changes yearly. I
Well,
don't
the board has been
anticipate.
provided, the bylaws has had an opportunity to review those. And with the four members present, does anybody have any suggestions for any changes or a meeting to work through something that they're concerned about?
What
Okay.
article was that, Kim?
That is number 5, understanding committees. And it says meet every February, March to review bylaws and make recommendations to the entire board for annual bylaws review at March meeting. So
Do we have any sort of a living
I think
calendar?
it's Article 8. Isn't that Article 8?
yes.
Yeah.
Sorry.
It's
I got ahead of
subsection,
myself.
yeah, subsection.
Article
G,
8G
5,
5.
I think so.
So perhaps it might be reasonable to suggest an action item in the next February's agenda to schedule a brief meeting and review of those. And I can set up a Teams meeting or we can meet in person.
Or if we don't anticipate, I mean, the changes made at the last meeting when we were here, when we met last year, it basically took us 10 minutes, 15. So I think with putting them out for board review,
Good enough.
I think don't you feel like that's enough? Do we need
As
to
long as
have a
we're-
separate meeting to?
Not unless it's stipulated in our bylaws. And if it
That's-
is, I'm going to make the suggestion that we change that.
That's what I was saying.
Oh, yay.
That's exactly what I was saying. Thank you.
All right. So
Maybe
you
I
have-
wasn't saying it clearly enough.
So we
but-
are, your suggestion to change to the bylaws. Would you like to
Yes,
make a
that's what
motion?
right here, I suggested that we might change this Article 8, number 5,
What would you like to change it to?
just basically stating that the bylaws are reviewed every February, March, and any recommendations are discussed in the annual board or in the monthly board meeting.
And discuss it at the March board meeting?
Yes. I don't think it's necessary to meet prior to that. I don't know that a 15-minute meeting is necessary.
So we're going to revise Article 8 to state that bylaws shall be reviewed and discussed at the annual March board meeting. Is that fair enough? Okay.
If you give me just a second.
I'm writing it too. So if I can clarify to give you some time, Article 8 shall state, bylaws shall be reviewed and discussed at the annual March board meeting.
Sounds good.
Is that accurate?
I
Right?
agree.
Is there a second?
I would
Go ahead.
just mention that, so when I first came on, one of the things that I heard of with previous boards was that the reason why you guys started to have these rules was because people were not meeting to revise and go through bylaws for years and years. And I'm not sure if it would be great to loosen the rules around it as far as our bylaws go, mainly for future boards so that they would have to be the ones to kind of say like, yeah, whatever, we're fine with the bylaws, we'll just let them be, that kind of thing. You could maybe make it every other year that you would like have an actual meeting to
Okay.
specifically discuss the bylaws, just so that it's in there. And if somebody says I can't take 15-20 minutes every 2 years to discuss
Right.
the bylaws, then at least
What do you-
they'll need to go on record and change that. I think every year, yeah, sure, like, probably doesn't need to happen, but to specifically set time aside to discuss them might be, something worth doing for future boards when we might not be around.
And either way,
Mm.
it just, the last one, I mean, they were just recently done. There wasn't a lot of change. I felt like we were there for maybe 15-20 minutes but yeah, I guess there's nothing to say that they can't change in the future, so. I'm fine with either thing.
Well,
Either thing's
and
fine
if
with
we
me.
do it every other, if we just make it pretty simple and says meet every other February, March to review bylaws and make recommendations to the entire board for bylaws review, scratch that annual. Then we're just doing every other year, every 24 months. That seems to work pretty well.
Twice in a term,
That's fine. We could do that.
And then we don't have to, I mean,
Sure.
I think Zach, they, to
Make a-
clarify, I don't think they were even looking at it at all.
I didn't think they knew they had.
They didn't even know they
weren't-
existed, did they?
So this, at least we were putting it in front of people to
Sure.
remind people to look at it. I don't think that, Dan, you would know better, but I don't think they even paid attention to it for years and years.
Not unless a problem arose, that was related to bylaws.
Mhm.
You have said it in the past, and you said it today, and Dr. Kingsley has said it to me. We're all not going to be sitting here in 10 years, very likely, or some of us won't. And we have no idea what future boards or future staff members would be doing. So this, at least, I think you make a great point. This keeps us kind of
Accountable.
following, yeah,
Yeah.
exactly.
That's good.
So
Okay.
we would need a motion to,
Yeah, we need a motion. Yep.
Is the term biannually?
Yeah.
Okay. Again, the Alzheimer's. So if there was a motion that read something like, bylaws shall be reviewed and discussed at the annual March board meeting every year, and the bylaw committee shall meet biannually. Is that simple
Prior.
enough?
Prior to the meeting.
Meet biannually, every other February?
Yeah, prior to the March meeting.
you want to bring it to the board every year, or do we just want to do both every other year?
I think the board should look at them every March.
Every
Yeah.
March, I think the
Yeah.
board, the
I
board
really
should,
took some time to read through them.
yeah.
I really drilled down again, and a lot of it seemed fresh, so that was neat. But I appreciate Zach's admonition that we ought to codify that a bylaw committee ought to get together and, even if it's only 15 minutes in person, it really forces us to really review those to come prepared to discuss.
Okay.
The board always has the option, if there are flaws that are brought up in the bylaws, to
Mhm.
change them as the board sees fit.
Yeah.
But this, again, we're trying to build a structure and a atmosphere where things are disciplined, and we're putting triggers in to have the board really look at that. Yes, we do have bylaws. Hey, how are we doing with those? So it's reasonable to have some formal meeting time for the bylaws committee, because it's a standing committee.
Sure.
That makes a heck of a lot of sense. Good suggestion.
So the first time we changed them actually happened like I said, because it was like 8 months after we had just passed them,
Mhm.
and we were doing
Right.
some sort of
But
business.
there were a few changes.
And there was actually quite a few.
Yeah. Mhm.
Because it conflicted with what we wanted to do, and we had to make sure the bylaws let us do, and I don't remember exactly what it was.
Mhm.
Is there a calendar that is utilized by the health department where we could put a memory trigger in there that says February, remind bylaws committee shall schedule a meeting prior to the March meeting?
Cindy does that, and that's not that Cindy,
Oh,
but
the other
one
one.
listening,
Okay,
and
So in my mind, I was thinking it was April, so there you go.
okay.
that's when we sent out the Cindy, so this is partially my fault.
Kim, would it be okay with you if I suggested a revised language in your motion?
I would love that.
So
Dr.
the
Shepherd. You
revised
go right
language
ahead.
of your motion is that Article 8 Article 8 shall be revised to state the following. Bylaws shall be reviewed and discussed at the annual March board meeting. And a bylaw committee shall meet biannually in February. I think I got that right.
Yes.
Let me state it again. Bylaws shall be reviewed and discussed at the annual March board meeting, period. Every other year, or no, take that out. All right, let me back up. Bylaws shall be reviewed and discussed at the annual March board meeting, period. A bylaw committee meeting shall, the bylaws committee shall meet biannually in February. Cindy, did you get all that? Okay.
Do you have any issue if we wordsmith that?
Wordsmith it.
Yeah, you could even like if it makes it more exacting, putting like if it's all right with you, like even or odd year, you could even
That
put
makes
that.
sense.
That way
Mhm.
it's like super simple and it's just
Sure.
on even
That's
numbered
what-
years we
Yeah.
meet.
That's what I
So
was
that's the
thinking.
motion. There will be a second. We'll see the language at the next board meeting.
We can do that.
Perfect.
Is there a second?
Seconded.
All right.
Yes.
So how about
I'm
we
voting
just
yes.
amend it and we'll bring back the proposed language. You basically voted to, or are going to vote to have us do this, but then we'll vote on the new bylaws next meeting. Once we see the language.
All right. So the motion is that we're going to task the executive staff with revising Article 8 as we have discussed. That's the motion. Or do we need to make a motion in a second and have it passed? I don't
You
think so.
probably don't need to.
Fine, good enough. All right, next item on the
So the
agenda.
plan would be to meet even years.
Yes, because
Okay.
we're not needing this.
Thank you. That's all
I need to make an amendment to the bylaws if I could. So Article 7, Section J. You take a look at that. It says the board adopts Robert's Rules of Orders for conducting meetings, except that only a trustee who makes the motion may amend the motion, which is kind of what we're just doing. But can we also make another amendment to that saying that the chair of the board can actually make motions and seconds and such? Because I guess according to Robert's Rules of Order, the chairman cannot do that.
Great.
Yes.
So
I
Jeff,
know in the,
let's let the executive staff work on the language for that and bring it to the April meeting.
okay.
Sounds good? We good with that?
Yes.
Yes.
All right.
Seeing we don't have to have a vote. We can have the language brought to us for the April meeting and we can vote on them.
Okay.
Great suggestions, guys. Okay,
Review and approve the bills.
I was looking at the agenda. Have the bills been reviewed?
Yes, they have.
I would
I move
entertain
that-
a motion to approve paying the bills.
I move that we approve to pay the bills.
Seconded.
Any further discussion? Hearing none, roll call vote, Kim?
Yes.
Michael Chaffee, yes. Zach?
Yes.
Jeff?
Yes.
Motion passes.
The resolution.
Okay. And I believe we do have some contract language to review for Swope Health. Is that right? I didn't see it in the agenda. I saw it in the packet.
It's in the agenda.
It's in the new business section.
So,
Oh, there it is. There it is. Okay. So I guess we're at banking services RFP?
Yeah.
Oh, fun. Oh, God bless you. Anybody want to play? Here's Zach. Go for it. Open them, announce who it's from.
do you want a letter opener?
No, we'll be all right. Thank you.
And who's that one from? It's like Christmas.
This is from Connections Bank.
Okay, so Connections Bank, for the record, has submitted a RFP for banking services.
Take a peek
All
at
right, I'll
that.
hold it for you.
Yeah. RFP and
Let's see who the next, so we have, is it 3 of them?
yes, we have 3 submissions. All right, so this one is Nottaway Valley Bank
Okay.
has submitted a bid for RFP.
And, all right, and the last one?
It is Central Bank, so make sure that's who it is on the inside of this. It's like Chris. All right, and Central Bank has submitted their bid for the RFP as well.
And that's our current vendor.
Is it? Okay.
So the current vendor is also, so I would entertain a motion to how to deal with these. I know what I would do if I was, as chairman, I would suggest a motion to table these, have the staff review them and come back with recommendations. Does anybody want to do that?
Fine with me.
Yes.
I can't make the motion until the bylaws are changed. Wait, you're the chairman. I'll make the
I'm
motion.
the chairman. You can do whatever you want.
All right, I would make the following motion to,
Does it reject all offers?
we will we have acknowledged these offers in receipt. And I would make the motion that the board task the staff with reviewing these and bringing recommendations to us. Is there a second?
Second.
Any further discussion? Oh, wait, there's a suggested motion language. Oh, Lord.
Well, looky there.
All right, I move to authorize the staff and finance committee to compare the banking services bids received and to return to the April board meeting with a recommendation. And Kim, you
I
seconded?
second that.
No further discussion. Roll call, Kim?
Yes.
Jeff?
Yes.
Michael, yes?
Zach, yes.
Motion passes. Point of information, will these be scanned in or will there be an electronic copy at any point? If there is, I would love a copy. If there's not, fine.
So Cindy, will you scan those for the
Well,
finance committee?
If they were planning to be scanned, fine. If they are not, I will take time to come in. We don't need somebody to scan them. Just,
I think she does already.
She does it for the finance
okay,
committee.
just let me know if they are, because I'd like to drill down deep on these. I have some savvy interactions and experience with all of them.
Can we make sure that it's an action item on the April meeting? That not only do we get the recommendations, but we can vote at that time if we wanted to?
Yes. Why not?
That doesn't mean we have to vote, but at least make it so that if we needed to, or we could, that the opportunity to be there.
Jeff, would that be something that maybe you and the director at your meeting might be able to decide if it's ready for, to come on the agenda yet?
That would be fine with me.
I guess I don't understand. Kingsley.
Well,
And he
he
was
says
trying to
that
say
it return to the
an
board meeting with
agenda
the
item for next
recommendation.
month to both
That can-
review and.
Can we actually vote on it at that time? According to the motion that's there, it just says for the April meeting for recommendation. But can we vote on the
Correct.
choice, or do we have to wait till like the May meeting to actually vote on it?
Board can do what it wishes to do with the recommendations from the staff.
Our
And
intent was to leave it in old business and you can vote on it at that time.
Yeah.
So yes, you'll be able to vote on it.
All right, that's fine.
all right, NPR insurance rates.
Cindy, do you want to cover that?
Sure. Last night, NPR, who is our insurance provider and administers our health insurance to the staff here, held their annual board meeting and voted on, well, the recommendation from their staff that they were reviewing premiums, the cost of premiums for health insurance. So their staff, their benefits team took to their board last night a recommendation of a 3% increase to the health insurance premiums. And so we have currently, the board makes a employer contribution to the insurance premiums currently, and they cover almost a single employee's premium. And that current amount is $660 a month, or excuse, yeah, a month. For a full-time person. That's how much the board is contributing. And so what our recommendation is that I'm gonna back up. In the budget, we did budget for a 6% increase in premium for an increase. So it is in the budget right now.
Midwest, question.
Mhm.
Midwest Public Risk is providing health insurance.
They provide the plans. They go out and do the spec for them.
So they're a broker.
Yes, basically.
It's a government risk pool.
Right.
Yes.
Okay, because, just earlier on Tuesday, for the Board of Services, we're seeing 20% increases year over year. So, that's good to know. All right, and what percent, is there a percent differential? I mean, let me back up. Do we encourage participation by the employees to pay something into the cost of their healthcare insurance?
Depends on which plan they choose.
Okay. So is there this is maybe getting in the weeds, but good business dictates that to recruit and retain, if you can have a plan where they have very little cost or deductible or input, that's fine. And then more extensive plans requesting participation of the employees in the cost of healthcare. Do our plan options provide the option for the employees to pay into it more?
Yes.
Perfect.
So we have two high deductible plans, and then we have kind of the older, it's not an HMO plan, but it's a copay type
Copay
thing, which
plan.
costs more. And basically what the board's contribution currently is pays for like a single person. It pays almost all the premium for a single person.
Cindy, do you have a contact at Midwest Public Risk? You could email me
Mhm.
so that I could try to help the citizens of Platte County
Sure.
for the Board of Services to see if they would be willing to take a look at benefits to them as well, because it seems like you're comfortable with them, they're reasonable.
Why don't you let us have them contact you?
Okay, thank you.
We don't really get a referral bonus or anything, but do you want them to contact you directly?
Please.
Okay, we'll take
All
care
right,
of that.
so can we go over the actual numbers though? So they're gonna have a 3% increase, but when does that actually get applied? Is that immediately as soon as we come up for contract negotiations, or when does that actually take effect?
July
They're
1st.
July 1st.
And when do we do our stuff?
So that was in our budget for January 1st. Planning on July 1st, so we planned on 6%, it's going to be 3. Last year, we planned for 10, and it was 0.
Okay, so then what do we do with that extra money that we're setting aside?
We just don't spend it. It's in the budget for that item, so it sits there, and at the end of the year, when we reconcile what needs to go into our surplus accounts, what needs to go to, basically, it's there for next year's budget process.
Okay, so right now we pay $660 a month. What would the 3% increase change what we pay into the employees' insurance then? What would that 3% reflect? What was that actually be?
It goes up $20 a year per person,
Month.
a month. I'm sorry, $20 a month per person.
So now it'll go up to $680 a month.
Correct.
Correct.
Okay. All right. That does seem pretty reasonable because like Dr. Chape was saying, I was at that meeting and insurance has been skyrocketing. But then again, maybe we have the wrong insurance company for the other place.
So this is a government risk pool, and Bridget I think the Board of Services should qualify. I just don't know for sure, but she will know. and
That's all I'm looking to do is look for options and find options.
But basically, instead of doing it through a commercial broker, this was started by Mid-America Regional Council. Probably, was it like 4 decades ago?
Yeah, and I think they have like 150 clients, government entities, so police departments, cities, probably board of services.
We were told that the Board of Services is a quote by our broker, that we are deemed a high risk group, which did not make sense to me.
Not for the
Not at
employees.
all.
And I am very engaged in pursuing how to mitigate increasing costs that don't make sense. So, thank you for that. And if they're comfortable reaching out to me, please give them my email, cell phone. The health department email is fine.
So it may not be Bridget, it may be their business development person, but someone will contact.
Thank you for the opportunity.
Okay, so getting back to the 680 a month, that's already in the cake. We don't have to do any kind of motions or anything like that. It's already baked in the cake. We're ready to rock and roll when it happens.
We need to approve it.
So I would make a motion to approve a 3% increase in the employer health insurance contribution for the 2025 to 2026 plan year.
Seconded.
That's the suggested language, Jeff.
Okay. All right. Even though we already have money set aside, we still have to do a motion. I just want to clarify.
We have to authorize the
Yeah.
increase.
Yeah.
Well,
Okay.
we budgeted, we approved a budget, but we have to authorize this increase. And
Yep,
I
I'm
like
on
that.
board. Okay.
Anybody like, I made the motion. Is there a second?
He seconded.
Great. Any further discussion? Hearing none, roll call. We'll go Jeff first.
Yes.
Yes.
Michael, yes.
Zach, yes.
All right, motion approved.
And Dr. Kingsley, we always do try to make sure we're covering the money in the budget, but if it's a new expenditure or a
Change.
significant increase, if it was $200, we would not need, I can approve that. But right now, the way it's set up is these bigger increases need to come to you as they should.
I get it.
If I could add just a couple of points, there are some local health departments in Missouri who are not eligible just to participate because they have fewer than 6 employees. I don't know if that would be a factor for the Board of Services.
They have 100.
You're fine. Right?
Okay.
And
I don't like to make, I apologize for interrupting you. I don't like to mix things,
yeah,
but
sure.
we are all in service of the citizens of
Right.
Platte County,
Exactly.
and some of Dr. Kings and I have dual roles that we're very passionate about.
Yeah.
And when we can find ways to better spend the tax dollars of our citizens and provide better services, we'd like to do so. So thank you for allowing me to digress and
Yeah,
share
well,
this.
and $680 for health insurance, dental insurance, and vision insurance for an individual seems like a pretty good deal, you know. And then one other thing, you had asked about if the employee can pay into. I'm not sure if you were headed down this path, but we can't pay into an HSA or an FSA if we
Great.
choose to.
Just making sure I'm not intimately knowledgeable about the health plans. I just want to make sure that we have that good companies usually have a couple tiers and options for the employees. Some may want to have a higher or lower deductible. Some may want to put no money in and take the benefit. Some may want to contribute. And as long as something is there and the employees are happy, and again, it's the executive team's discretion that's adequately, it's adequate for our current employees and for recruiting purposes, and that we're competitive. That's my only concern, is make sure we're there, and it sounds like we are.
Yeah, it's just, and most of you have seen all kinds of variations. Sometimes you pay more on the premium, and then they give you money to put into your HSA or whatever. There's all kinds of combinations of how that works. This is the first place that I've worked in some time that completely pays my individual premium in any of the plans. And then I have more freedom to, which for my dental or for my vision or to put more money into my HSA or whatever. I like how things are structured here. It's great for me coming from other places. I don't know, Taylor, you don't like it, but it,
Well, I think this year we're gonna plan to add in a copay plan, where this past year we did not have a copay plan, so it's both high deductible plans, so I have been getting nickel and dimed. But
My experience in business is that requiring employees to participate in the cost to some degree is reasonable. And that there are issues with cost creep, and some insurance companies will continue to inappropriately raise the rates. And it doesn't affect employees. For example, good, well-managed companies will set a benchmark of X% of their annual revenues that they're willing to contribute to help employees' health. I use 3.5% of our annual revenues, and that when we started to go over 3.5% in the cost of healthcare for the employees, we would share that cost, that increase above 3.5% with the employees, going from a 80-20 plan, and when it got to 5%, we went to a 70-30. It's reasonable, it's customary in business, but health departments are historically maybe not the highest paying positions, and it's important to be able to recruit with robust benefits. And while the salaries may not be high, they will see other items that are part of the benefits package, which makes it a nice place to work. So it's that balance that we just try to make sure that is managed.
Hey, Andrew, you don't have to give me like all the complete numbers and such, but so for what would a spouse be on top of what normally would pay for? So we pay the amount for the employee. The spouse is how much more per month that the family have to pitch in?
so there's a couple tiers, so it's the spouse and then it's spouse and kids, which is the family, and it's quite a bit. You have
And
those,
and that's per month, right?
it is,
Yeah.
and we have the numbers, we just didn't put them
Jeff?
all up there.
Can we have Cindy just maybe send out that as
we're
an
gonna-
email?
We're gonna have to go through all this anyways when we decide when we up the insurance, all that kind of stuff anyway, but right, we're gonna have to go relook at all the benefits and all the packages stuff eventually here this year anyway, right?
Not necessarily.
Okay.
I would suggest that Cindy sends the current plans and the employee options to the board to review.
Do you have that table? Yeah, we'll just email it to the board.
Great.
She'll probably, I don't think she has her computer, but
Well, I can take a picture of it now, send it as a PDF to the board if they
Well-
want it.
we'll send it. That way it's all on our email.
Okay.
I would like to save it in my files. Since I don't remember things. Okay. SWOPE annual amendment to primary healthcare services agreement. If you want to pull that up.
Yeah, I don't know, was there a vote?
Did we
We
vote?
voted.
Okay,
we did a roll call.
We did
vote.
a roll call vote. Yeah.
I got you.
It was unanimous.
SWOPE health amendment to primary healthcare services agreement. I'm gonna just try to leave this for efficiency and time. Did all the members get an opportunity to review it?
Yes.
Everybody understand it?
Mhm.
I would entertain a motion to approve it unless there's discussion that needs to go on, because it's very
And our
straightforward.
attorney reviewed it.
Straightforward.
Yeah, it's straightforward. In summary, it is a stipulation and a requirement for them to remain a federally qualified health clinic, that they have to have this language in their contract. And this is not a change in services or anything else. So I would entertain a motion.
Move to approve the director to sign the first amendment to primary healthcare services agreement MOU between Swope Health Services and Platte County Health Department.
I second that.
Tim seconds. Any further discussion? Hearing none, roll call vote. Kim,
Yes.
Jeff,
Yes.
Michael, yes.
Zach, yes.
Zach, yes. Approved unanimously. We already covered the bylaws annual review. All right, no public to make, oh,
There is one
go
more
ahead.
thing that did not get on the agenda.
Okay.
That I think we put there, which Dan, I don't know if it's in the
Mutually.
folder, I don't know if you can pull that up. But it's for mutual aid agreement for environmental health services. So through the State Department of Health and Senior Services,
You need to ask if we can add
Oh.
it to the agenda.
sorry, can we add to the agenda, mutual aid agreement for environmental health services?
I,
Do we need
I
a
don't have a problem with it.
the board consents.
we don't need a roll call vote.
No,
No.
whoever's acting as chair just needs to say that's okay.
Sorry.
Oh, you're fine.
But yeah, so the Missouri DSS, they offer incentive funding to local public health agencies. And one of the things that they are asking that we do to get some of that incentive funds are having mutual aid agreements with other health departments, for environmental health services, which essentially means if they have some sort of environmental health issue that comes up and they can request to borrow some of our environmental health staff, then we would be given 2 days to either approve or deny that request. So this is just saying that we're available to either request it from neighboring health departments or to be giving aid. So Clay County had reached out and asked if we would sign this, but we actually get more if we have a second county. So we plan to reach out to Kansas City as well and have them sign it. And there might be some other neighboring health departments that reach out to us that want to be part of it as well. Are any questions?
So just to clarify, if they request it, we are not obligated that we have to do it. You know, it depends on what the event is. If it was like the Joplin tornado, there was a lot of mutual aid at that time. People went down, a lot of volunteers and a lot of restaurants and stuff. It was actually a kind of an environmental health nightmare because people are like, well, people got to eat. So this chicken that's been sitting out here for 4 days should be fine. Well, we don't want to have a tragedy on top of a tragedy. But we have the option of saying, no, we can't help. Now, if it's down like in Joplin, we would certainly go try to help. But if we're experiencing the same storm as Clay County, we're going to need those people. So we're going to draw from someplace else.
What is the incentive funding? Just curious.
Comes from DHSS. It goes, we will earn 10% if we sign 2 agreements. We will earn 15% of incentive funding from DHSS.
So last year,
But what is the incentive funding though? That's only 10% or whatever. What is the actual incentive funding?
so we did it last year too. It was actually Zach, you came for the training before you were actually on the board. We got incentive funding for doing that. So it's, I think, 20-some thousand dollars, or how much is it this year?
Around that.
It's 20-some thousand dollars. So we're going to get 10% of that or 15% of that 20 for doing these pretty easy things. Last year we had the training that Tiffany came and did. We got like 10 or 15% of that money. So the only thing we didn't get last year was we didn't get money for being accredited because we weren't accredited. But we did all the other little things they wanted us to do, including the commissioners all got trained at
Yeah,
their
remember that.
state commission meeting, state commissioner association meeting, or that's not what it's called, but
I guess so. Then what have you guys thought at all about what the estimated cost of like sending these folks out and sharing our resources, what that would look like to us if
So
we're looking
it
at like
depends.
$2,000?
so it
Maybe.
depends.
Yeah.
But typically, these mutual aid things are only going to happen when there's a emergency declaration. And then we're going to get paid back for what we spent.
Gotcha.
So I'm not too worried about like getting paid because we'll get paid for whatever we spent typically. Now, it could be a smaller scale thing.
Mhm.
So Kansas City might have 4 truck wrecks and they want us to go help.
Yeah.
We're going to kind of eat that, but we're also going to build up some you owe me kind of credits. that we have the same thing because we have I-29 and we have slick spots, then we can, and we're smaller, so we're always gonna go help. We kind of did this with the whole TV thing, with Wyandotte County. I was not very selfless. I was very selfish. I wanted our people to go over to Wyandotte County
Good
and
experience.
learn and get the experience of how they were dealing with it. They thought, oh my gosh, you guys are so nice, sending these people over for 2 or 3 days to help. No, I am getting free on the job training from CDC and KVHE and from your team. It's very beneficial for us because we might not, well, we hope we never see it, right? So, but this year or last year, when we had some of those things knocking on our doorstep, we were very comfortable and already knew the people.
And since it's an MOU, it's non-binding.
Right.
It doesn't change the fact that we would discretionarily evaluate each and every situation as we do now
Right.
to determine if it's in the best interests of all involved and if it's the right thing to do. This MOU is leveraging the offer of incentive funding from DHSS to increase funding for doing what we're already doing. Is that a fair summary?
It's formalizing the agreement, but yes, we would be doing this
Yeah.
anyway.
And it's non-binding.
Right.
So we are not encumbering resources or funds at this point, but we are taking advantage of incentive funding. Is that fair to summarize? All right. I'd entertain a motion unless there's further discussion.
Well, I do have a quick question though. So any kind of services that we provide, we have to front the money up ahead of time, and then we get reimbursed with this funding or whatever later. Like, what's the time frame that we get refunded?
It could be some time that, we would get paid back for that emergency declaration, but it's also really some great experience for any of our teams to be able to go do. So we would not, or I would not authorize people to go at our detriment. I would make sure we could still handle it. So it might be sending 2 people for a week each, or it might be sending 3 people for a week each, whatever we could handle. And then we'd be like, we're done. I mean, that's all we can really spare because we have our own obligations. Does that make sense, Dr. Kingsley?
And then are employees under their auspices, or do we still make the decisions with our own employees?
They're going to be under whatever ICS command structure is at that event. So they are going to be reporting to their people. Now,
Okay.
they're still going to be our employee. They're going to be covered under our insurance, under our workman's comp stuff. But they are not going to be reporting to me typically. Now, if they have an issue, and it'd actually be reporting to Bailey or to Dan, ultimately under me. But yeah, they might call and say, hey, this is a mess and we don't really want to be a part of it, and we would get them out of it. But day to day, they're going to do what they're told by whoever's on scene. Does that answer your question?
Yep.
Everybody understands what the term ICS stands
Oh,
for.
I'm sorry.
I'll do it for everybody because in emergency medicine, this is part of our training. Incident Command Center or service or structure. So if there's a train derailment in up near Weston or near, they will deploy and have an incident command services center where they have a leader who will assess the resources they have, where they're from, and make decisions about deploying those resources. So we would be sending people at the discretion of the executive director to participate and assist in any kind of declared emergency or other request. And if it's a declared emergency, we will get reimbursed for those services. And we do have an emergency reserve fund already baked in to cover that for something like that. So we're not going to be going negative in the budget.
Well, and for those employees where you already have them budgeted, so it would just at the end of the year we put that revenue back into those. So we'd actually come out with kind of a surplus.
Okay. So we have a motion and a second. Any further discussion? Jeff, was that satisfactory for you?
That's fine with me.
Yeah, I have one question,
Sure.
more so a request, would it be worth having like some formal report made at some point within 2 to 3 months, if this is enacted by someone to provide those services, to have some kind of report made that would be reviewed at like one of the board meetings in the upcoming, like 2 or 3 months after the event? So that we can at least like show that this is something that, has been worthwhile. And
Would that be in the director's report?
It would be in whoever's report sent the people for sure. And
Yeah,
it's
And we're
kind of like what
authorizing
we
the
did with the
director
TV
to
thing. Those are
make that
things
decision.
that are,
Sorry.
we are always going to report those to the board, because those are the types of things that frankly are pretty exciting and atypical.
Mhm.
And so a lot of our reporting from month to month, I don't think you have to worry. We are going to definitely tell you that we responded to the tornado in Adair County
Mm-hmm.
at the restaurant we went to for that meeting, or whatever it is,
Sounds good.
because we're gonna be excited about it. So it will be taken care of.
I believe any director in the position, not talking about Mr. Warren, any director's duty would be to inform the board of participation in such items. And if a director did not inform the board, I think that's going to be a offline discussion had with that director at that time. I would hope so.
It also would probably be newsworthy.
Yeah. That, and we're
Local
going to say
newsworthy.
we helped with that. And then, of course, once the whole incident's done, Dan pointed out, there'll be a pretty significant after action report, and usually recognition of who all sent people and who participated.
Yeah, that's more so what I'm interested in, is having something like that. Yeah.
From my experience in 2 years, or just short of 2 years, it seems to be the modus operandi of the entire director, deputy director, and the executive team that we are well informed about the activities of the health department already. But if there is a need, maybe bylaws, we could codify some of that. But I think this is one of those items, at least my sense is, we're going to hear about it, we're going to get a report, and there will be a formal report added to one of the director's reports that will be in the minutes.
Yeah, I don't feel like that's an issue at this time.
I don't yet either, but I like that you're bringing it up.
Yeah.
Because I want to, and Dr. Kane, we all want, if I can speak for the board, the entire board wants everybody, every trustee to freely make suggestions and ideas and things, and not just assume.
Mhm.
Great suggestion. We're ready for a roll call vote unless there's further discussion. Hearing none. Kim?
Yes.
Jeff?
Yes.
Michael, yes.
Zach, yes.
Passes. Anything else to be added?
Can I add a few things before we go into executive session?
Well,
Number one, the what?
go ahead. Yes, please.
I was gonna say, so I guess NALBO is October 6th to the 8th. I know we haven't actually talked about it for a while. Mike and I went to it. It was a lot of fun. It was in Nashville. This year it's going to be in Charleston, South Carolina, I believe. I won't be able to make it because I'll be working at that time frame, but I would highly recommend other board members, if they're interested in going, or even somewhat interested in going, to at least start looking into it and start making reservations for it. It's well worth your time. And then the second thing I want to bring up real quick is, I know Dan says he's planning on retiring. I was hoping that he would be working on maybe like the history of the Platte County Health Department stuff before he walks out the door. If that's something that he's been working on or still working on. I mean, after you've been there 30 years, you kind of have a gist of how things have been going. So
Yeah, I'll do that. I'll put something together.
Right.
even if it's only like a couple pages, because once this board is gone, once Andrew is gone, all of us are gone, all that stuff that we saw or heard, that's going to have to be in a public record somewhere. Because
Isn't there something on our website about the history of the health department?
There's some, and when we did the open house, we had some, but Dan always tells me it's things were terrible here. He got here, things got great. He's leaving, it's gonna be terrible again.
Things are falling apart.
That's what he.
Well, no, they're not. If he does his job and grooms his replacement,
Yeah.
Well, see,
so we're in good shape.
yeah,
We're in good shape. We have some good replacements.
The Nalbo, perhaps Jeff, one of us should send a reminder email to the other trustees about that. If you send, I'll,
let's do this. Cindy Cogan, would you please send the link to Nalbo to all the board and then ask them to let you know if you're interested directly? Thank you.
Sure.
And then it's still gonna be fully reimbursed and all that kind of stuff, right? Travel, all, hotel, it's all being reimbursed, right?
Some rules on it, no private jet this year.
Right. I learned my lesson last time. I won't do it again, I promise. And then what was the state meeting that Susan and I went to?
So that was the public health, joint public health conference in September.
Okay, make sure you put that in that notice as well, so that if they want to go to the state meeting, anybody in the board, I would highly recommend going to that as well. I thought that was informative, so.
And when is that?
It'll be the second or last week of September.
Okay.
It's always roughly the same time of year. At least for the past 20 some years, right?
Yep. Sounds good.
Okay, I said what I needed to say.
Any other new action items? Anything that any of the trustees wish to bring up and discuss? Hearing none, I would suggest we consider moving into executive session unless there's any
Yep,
concerns.
say when the next meeting is.
Our next board meeting is April 17th, 2025 at 6 p.m. Right here at 7925 Northwest 110th Street, KCN.
That's it.
All right. I would entertain a motion to move into executive session.
I move that we move into executive session pursuant to 610.02 subsection 1, subsection 2, subsection 3, and subsection 13 RSMO 2000. Camera and microphone will be turned on when regular session resumes.
Okay. Is there a second?
Second.
Kim seconds. Any further discussion? Hearing none. Roll call vote, Kim?
Yes.
Jeff?
Yes.
Michael, yes?
Zach, yes.
Zach, yes. So we will move into executive session now. If we can keep Dr. Kingsley live and then the recording goes down. And we may need just to summarize.
Yeah, if we can
Briefly.
take just a minute to let everyone go.
Yeah.
Did you stop it?
Yeah.
We did a big, long executive session Tuesday night at the Board of Services.
Mm.
I'm the secretary there. I was scribbling. But I like to.
Thanks
at
for the
least-
reminder. I got to scribble.
Well, put bullet points